Welcome to Cancer Questions with Dana-Farber. My name is Suzanne Menon, a women's health nurse practitioner with the GYN group at Dana-Farber. Today's question is, are there any screening options for gynecologic cancers? Cervical cancer is the most preventable of all the gynecologic cancers. About 90% of cervical cancers are caused by the human papillomavirus, or HPV. Cervical cancer generally takes many years to develop, and in that time, early changes can happen which can be detected on a Pap test. It's also possible to test for the high-risk strains of HPV. Both of these tests together are recommended screening tests for cervical cancer. The U.S. Preventative Services Task Force, or USPSTF, recommends that all individuals with a cervix start cervical cancer screening at age 21. A Pap test combined with high-risk HPV screening is only screening for cervical cancer and is not screening for ovarian cancer or uterine cancer. There are currently no recommended screening tests for healthy women without symptoms for ovarian cancer. And in fact, the USPSTF recommends against screening healthy women without symptoms with transvaginal ultrasounds and CA-125 because they found no evidence that this reduces mortality from ovarian cancer and may actually cause harm by increasing unnecessary surgeries. If you have persistent symptoms, like abdominal bloating, pelvic or abdominal pain, changes in your bowel or bladder function, you should speak to your healthcare provider to see if there are any recommended screening tests based on your symptoms. Similarly, there are no recommended screening tests for healthy asymptomatic women for uterine cancer. If you have abnormal uterine bleeding or postmenopausal bleeding, you should speak to your healthcare provider who may recommend an endometrial biopsy or an abdominal or transvaginal ultrasound, which can detect abnormalities in the uterus.